Indications. Jaypirca is indicated for the treatment of adult patients with relapsed or refractory chronic lymphocytic leukemia or small lymphocytic lymphoma who have previously been treated with a covalent BTK inhibitor. Jaypirca is also indicated for the treatment of adult patients with relapsed or refractory mantle cell lymphoma after at least 2 lines of systemic therapy, including a BTK inhibitor. This indication is approved under accelerated approval based on response rate. Continued approval for this indication may be contingent upon verification and description of clinical trial benefit in a confirmatory trial. Important safety information for Jaypirca, pirtobrutinib. Infections. Fatal and serious infections, including bacterial, viral, fungal, and opportunistic infections occurred in Jaypirca-treated patients. Across clinical trials, grade greater than or equal to 3 infections occurred, 25%. Most commonly pneumonia, 20%, fatal infections, 5%, sepsis, 6%, and febrile neutropenia, 3.8%, occurred. In patients with CLL, SLL, grade greater than or equal to 3 infections occurred, 32%, with fatal infections occurring in 8%. Opportunistic infections included pneumocystis, jirovecii pneumonia, and fungal infection. Consider prophylaxis, including vaccinations and antimicrobial prophylaxis, in patients at increased risk for infection, including opportunistic infections. Monitor for signs and symptoms, evaluate, and treat. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Hemorrhage. Fatal and serious hemorrhage has occurred with Jaypirca. Across clinical trials, major hemorrhage, grade greater than or equal to 3 bleeding, or any central nervous system bleeding, occurred 2.6%, including gastrointestinal hemorrhage. Fatal hemorrhage occurred 0.3%. Bleeding of any grade, excluding bruising and petechiae, occurred 16%. Major hemorrhage occurred when taking Jaypirca with 2% and without 0.6% antithrombotic agents. Consider risks/benefits of co-administering antithrombotic agents with Jaypirca. Monitor for signs of bleeding. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Consider withholding Jaypirca 3 to 7 days pre- and post-surgery based on surgery type and bleeding risk. Cytopenias. Jaypirca can cause cytopenias, including neutropenia, thrombocytopenia, and anemia. Across clinical trials, grade 3 or 4 cytopenias, including decreased neutrophils, 27%, decreased platelets, 13%, and decreased hemoglobin, 11%, developed. Grade 4 decreased neutrophils, 15%, and grade 4 decreased platelets, 6%, developed. Monitor complete blood counts regularly. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Cardiac arrhythmias. Cardiac arrhythmias occurred in patients taking Jaypirca. Across clinical trials, atrial fibrillation or flutter were reported in 3.4% of Jaypirca-treated patients, with grade 3 or 4 atrial fibrillation or flutter in 1.6%. Other serious cardiac arrhythmias, such as supraventricular tachycardia and cardiac arrest, occurred 0.4%. Cardiac risk factors, such as hypertension or previous arrhythmias, may increase risk. Monitor and manage signs and symptoms of arrhythmias, e.g., palpitations, dizziness, syncope, dyspnea. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Second primary malignancies. Across clinical trials, second primary malignancies, including non-skin carcinomas, developed in 9% of Jaypirca-treated patients, most frequently non-melanoma skin cancer, 4.4%. Other second primary malignancies included solid tumors, including genitourinary and breast cancers, and melanoma. Advise patients to use sun protection and monitor for development of second primary malignancies. Hepatotoxicity, including drug-induced liver injury (DILI). Hepatotoxicity, including severe, life-threatening, and potentially fatal cases of DILI, has occurred in patients treated with BTK inhibitors, including Jaypirca. Evaluate bilirubin and transaminases at baseline and throughout Jaypirca treatment. For patients who develop abnormal liver tests after Jaypirca, monitor more frequently for liver test abnormalities and clinical signs and symptoms of hepatic toxicity. If DILI is suspected, withhold Jaypirca. If DILI is confirmed, discontinue Jaypirca. Embryo-fetal toxicity. Jaypirca can cause fetal harm. Administration of pirtobrutinib to pregnant rats caused embryo-fetal toxicity, including embryo-fetal mortality and malformations at maternal exposures, AUC, approximately 3 times the recommended 200 mg per day dose. Advise pregnant women of fetal risk and females of reproductive potential to use effective contraception during treatment and for 1 week after last dose. Adverse reactions, ARs, in patients who received Jaypirca. The most common, greater than or equal to 30%. ARs in the pooled safety population of patients with hematologic malignancies, N equals 704, were decreased neutrophil count, 54%, decreased hemoglobin, 43%, decreased leukocytes, 32%, fatigue, 31%, decreased platelets, 31%, decreased lymphocyte count, 31%, calcium decreased, 30%. Mantle cell lymphoma. Serious ARs occurred in 38% of patients, with pneumonia, 14%, COVID-19, 4.7%, musculoskeletal pain, 3.9%, hemorrhage, 2.3%, pleural effusion, 2.3%, and sepsis, 2.3%, occurring in greater than or equal to 2% of patients. Fatal ARs within 28 days of last dose occurred in 7% of patients, most commonly due to infections, 4.7%, including COVID-19, 3.1% of all patients. Dose modifications and discontinuations due to ARs. Dose reductions in 4.7%, treatment interruption in 32%, and permanent discontinuation of Jaypirca in 9% of patients. Permanent discontinuation in greater than 1% of patients included pneumonia. Most common ARs, greater than or equal to 15%, and select laboratory abnormalities, greater than or equal to 10%. All grades percent, grade 3 to 4%. Hemoglobin decreased, 42, 9. Platelet count decreased, 39, 14. Neutrophil count decreased, 36, 16. Lymphocyte count decreased, 32, 15. Creatinine increased, 30, 1.6. Fatigue, 29, 1.6. Musculoskeletal pain, 27, 3.9. Calcium decreased, 19, 1.6. Diarrhea, 19. Edema, 18, 0.8. Dyspnea, 17, 2.3. AST increased, 17, 1.6. Pneumonia, 16, 14. Bruising, 16. Potassium decreased, 13, 1.6. Sodium decreased, 13. Lipase increased, 12, 4.4. YLT increased, 11, 1.6. Potassium increased, 11, 0.8. Alkaline phosphatase increased, 11. Grade 4 laboratory abnormalities in greater than 5% of patients included neutrophils decreased, 10, platelets decreased, 7, lymphocytes decreased, 6. Chronic lymphocytic leukemia/small lymphocytic lymphoma from single-arm and randomized controlled clinical trials. Serious ARs occurred in 47 to 56% of patients across clinical trials. Serious ARs in greater than or equal to 5% of patients in the single-arm trial were pneumonia, 18%, COVID-19, 9%, sepsis, 7%, febrile neutropenia, 7%. Serious ARs in greater than or equal to 3% of patients in the randomized controlled trial were pneumonia, 21%, COVID-19, 5%, sepsis, 3.4%. Fatal ARs within 28 to 30 days of last Jaypirca dose occurred in 8 to 11% of patients, most commonly due to infections, 7 to 10%, including sepsis, 5%, COVID-19, 2.7 to 5%, and pneumonia, 3.4%. Dose modifications and discontinuations due to ARs. Dose reductions in 3.6 to 10%, treatment interruption in 42 to 51%, and permanent discontinuation of Jaypirca in 9 to 17% of patients. Permanent discontinuation in greater than 1% of patients included second primary malignancy, pneumonia, COVID-19, neutropenia, sepsis, anemia, and cardiac arrhythmias. Most common ARs and select laboratory abnormalities, greater than or equal to 20%. All grades percent, grade 3 to 4%, in a randomized controlled trial. Neutrophil count decreased, 54, 26. Hemoglobin decreased, 45, 10. Platelet count decreased, 37, 17. Pneumonia, 28, 16. ELT increased, 25, 1.8. Creatinine increased, 25. Calcium decreased, 23, 0.9. Sodium decreased, 22, 0.9. Bilirubin increased, 21, 0.9. Upper respiratory tract infections, 21, 0.9. In a single-arm trial, neutrophil count decreased, 63, 45. Hemoglobin decreased, 48, 19. Calcium decreased, 40, 2.8. Fatigue, 36, 2.7. Bruising, 36. Cough, 33. Musculoskeletal pain, 32, 0.9. Platelet count decreased, 30, 15. Sodium decreased, 30. COVID-19, 28, 7. Pneumonia, 27, 16. Diarrhea, 26. Abdominal pain, 25, 2.7. Lymphocyte count decreased, 23, 8. ELT increased, 23, 2.8. AST increased, 23, 1.9. Creatinine increased, 23. Dyspnea, 22, 2.7. Hemorrhage, 22, 2.7. Lipase increased, 21, 7. Alkaline phosphatase increased, 21. Edema, 21. Nausea, 21. Pyrexia, 20, 2.7. Headache, 20, 0.9. Grade 4 laboratory abnormalities in greater than 5% of patients included neutrophils decreased, 23. Drug interactions. Strong CYP3A inhibitors. Concomitant use increased pirtobrutinib systemic exposure, which may increase risk of Jaypirca ARs. Avoid using strong CYP3A inhibitors with Jaypirca. If concomitant use is unavoidable, reduce Jaypirca dose according to approved labeling. Strong or moderate CYP3A inducers. Concomitant use decreased pirtobrutinib systemic exposure, which may reduce Jaypirca efficacy. Avoid using Jaypirca with strong or moderate CYP3A inducers. If concomitant use with moderate CYP3A inducers is unavoidable, increase Jaypirca dose according to approved labeling. Sensitive CYP2C8, CYP2C19, CYP3A, PGP, or BCRP substrates. Use with Jaypirca increase their plasma concentrations, which may increase risk of ARs related to these substrates for drugs sensitive to minimal concentration changes. Follow recommendations for these sensitive substrates in their approved labeling. Use in specific populations. Pregnancy and lactation. Due to potential for Jaypirca to cause fetal harm, verify pregnancy status in females of reproductive potential prior to starting Jaypirca. Presence of pirtobrutinib in human milk is unknown. Advise women to use effective contraception and to not breastfeed while taking Jaypirca and for 1 week after last dose. Geriatric use. In the pooled safety population of patients with hematologic malignancies, patients aged greater than or equal to 65 years experienced higher rates of grade greater than or equal to 3 ARs and serious ARs compared to patients less than 65 years of age. Renal impairment. Because severe renal impairment increases pirtobrutinib exposure, reduce Jaypirca dose in these patients according to approved labeling. Please see prescribing information and patient information for Jaypirca on surrounding page.